It's Jennifer Huff. I'm the owner of Your Aging Therapist, and I'm here today with one of my occupational therapists, Will Strickland. And I'm really excited. I don't normally do this type of thing, but I really want to celebrate my therapist's accomplishments, and he has a really big accomplishment to share. But before we get started with that, I just want to have him introduce himself and give a little of his background.
My name is William Strickland. I'm an occupational therapist. I work with Jennifer. She's my boss. At Your Aging Therapist, we do outpatient in a home setting for elderly population. I graduated in December of last year, 2023. Started working in March, licensed in South Carolina and Georgia. Really enjoy my job. If anybody's interested in being an occupational therapist, please just follow through with it because it's an awesome job. But yeah, got a recent patent application grant, and so my invention is ready for market.
All right. So, as far as the patent goes, tell us a little bit about what it is and what initially inspired you to develop the program.
Okay. During the COVID-19 epidemic, in clinic care was being limited a lot, just because everybody didn't know what we were dealing with, and it was coming to my attention that if we wanted to see the progression of a patient on their engagement in home exercise plans, like were they doing it or not, how could I gauge that other than just hearing them say that? And what if they couldn't come into the clinic? What if my clinic access is limited? And what if I have to see more pressing patients, more so than these? And I just want to keep progress. And so I came up with a way to virtually measure their range of motion, just to see, are you progressing or not? Have you been moving? What are you healing like? And so now we have a virtual way to do that that's very accurate.
Okay, awesome. So I guess that kind of leads into my next question was there a specific gap in the market that you were trying to address by developing this? It sounds
Yes.
like just access.
Yeah, absolutely. And anybody in the therapy world knows that goniometers are accurate in about 4 to 6 degree range, depending on the user and depending on the experience of the user. But with this application, it's accurate to the 10th degree. Okay. And so much more accurate, but it's still based upon user experience. So I wouldn't advise anybody to use this if it wasn't licensed. But right. As long as you know what landmarks you're trying to hit, then you can be very accurate with it.
Perfect. Okay. So can you walk us through the process of how the program works and who it's used for?
All right, here we are using the app. I'm filling the role. I'm Will, filling the role of therapist. Jennifer is filling the role of patient. If you're working with a patient on virtual health, you're going to have a meeting platform downloaded anyway. In this case, we're using the Zoom Workplace. And so I would have already seen my patient in person and gone over what risk flexion looks like. But just so the patient remembers, we're going to go through it one more time. But first, we're going to pull up, you have your meeting platform pulled up, then the provider will go to their desktop and pull up the Movement Measures app. The provider is the only one that has to have this app downloaded. The patient only has to have the meeting platform downloaded. So we pull up our meeting platform, and then we pull up from the desktop our Movement Measures app. We overlay the window right here. You can still see the meeting platform. And so now, Jennifer, we're going to see if you remember what wrist flexion looks like. So hold your hand in front of you, and you want to make sure the patient doesn't have anything on their wrist or the joint that you're measuring, right? If you can see the skin, it's better. So nothing's throwing off your measurement. So go ahead and do wrist flexion for me. Perfect. All right, come back up. And that was a good wrist flexion because her stationary arm did not move. All right, now we're going to do it again, but I'm going to tell you when to move. So the app works like this. I will click 3 times. The first click will be at the bottom of my stationary arm, about midpoint of the forearm or wrist flexion. Second point, which is the point of the fulcrum, will be about right here. And then the third point, go ahead and move down the wrist flexion. Okay, and then we're going to come to right here, boom. And so now we know she is at an angle of 100 degrees of wrist flexion. And the back angle is 80, which will equal 180, right? And so now we know that she's at 100 degrees of wrist flexion. The green will correlate to the green, blue to the blue. And from here, we can save this snapshot. And all we have to go to is adjust, save snapshot. Can only save when it was opaque. Okay. They gave you that key right there. And then you can invert colors. You can blur background. Let's blur background. right here. So when we blur background now, we can save the image because this is what takes the patient's face out of the picture. And that allows it to be HIPAA compliant. But we know who it was, right? Save snapshot, image captured. So now the image is captured and saved to my images, which are, go to File, Open Images, Image 1. When I open this image up externally, now I can drag and drop this image to my desktop or to a note that I'm working on. So everything's HIPAA compliant. We can invert colors. We can go here to invert colors. We can go to display data, log current data, save snapshot we just did. Well, to save the snapshot, your background has to be blurred to make it HIPAA compliant. And that's how the app works. Thank y'all for your time.
Okay. And theoretically, could you use it if you were with the patient as well? Like if you didn't have a goniometer?
Yes, absolutely. You can use it in the clinic. I think it would be very useful for, I know in burn patients, you have to be very meticulous about how far you push them based upon skin healing. And so it would be way more accurate for that and probably way more helpful than a goniometer.
Yeah.
Because you wouldn't have to sterilize the goniometer and worry about like infectious disease control.
Oh, that's a good point. And so how would you envision this invention, changing our profession or advancing our profession?
I think it gives us like another tool in the toolbox. Like if I can see more patients per day in an accurate way, then I'm providing better quality care. It's a more accurate tool in the goniometer, and it limits infectious disease, and it also gives me access to patients that maybe be in a more rural setting. Like say I'm not able to drive an hour to see a patient, but I want to see how they're progressing with the HEP that I give them. And I would only give an HEP to a patient that I would trust to follow through.
Right.
But it's just a good tool to check and see, hey, are you doing what we're instructed to do?
Awesome. Well, thank you so much. I'm very excited to try it out, and hopefully we can get this out to the masses.
Awesome. Thank you.